Welcome to this video about an introduction to SLCN, part 1 of 4, Basic Awareness. What are speech, language and communication? Making sounds. The sending and receiving of messages, verbal and non-verbal. And how meaning is conveyed, receptive and expressive language. Breaking down speech, language and communication. Speech is how we make or articulate sounds, and how we put these sounds together to make words using our mouth, lips, vocal cords, tongue and breath. Language is a system of sounds, signs and words that convey meaning. It includes vocabulary, grammar and word order. It can be divided into understanding, which is receptive language, and expression, through spoken words, signing, writing, or an electronic communicator, which is expressive language. And communication is the sending and receiving of messages using spoken or written language, non-verbal sounds, gestures, body language or symbols, including writing. Knowing when to use different types and styles of communication, including intonation, tone, turn-taking and eye contact, are known as social communication or pragmatics. What elements make up communication skills? Communication is multifaceted. It is verbal and non-verbal. It relies on interaction and pre-verbal skills, such as being responsive, making eye contact, taking turns, reacting and initiating. It builds on listening and attention skills, and being able to follow direction from others and share in an activity or interest. We need to understand before we will be able to use language, and oracy comes before literacy. The communication chain. It is an incredibly complex process. What is the definition of a speech, language and communication need, SLCN? Children with SLCN may have difficulty with only one speech, language or communication skill, or with several. Children may have difficulties with listening and understanding, or with talking, or both. Each child also has a unique combination of strengths. This means that every child with SLCN is different. Speech, language and communication needs, SLCN, is the term given to describe the extensive range of needs related to all aspects of communication, from understanding others to forming sounds, words and sentences, to expressing ideas and emotions, and using language socially. Why are definitions of SLCN different? SLCN is not consistently defined. It encompasses a wide range of needs. There is a high degree of comorbidity, and there are variations in the terms used to describe subgroups of SLCN. In addition, a child's SLCN will usually change over time as they develop, meaning that numbers vary by age, type, and severity of SLCN. We can conceptualize SLCN simply as the term used to describe difficulties with listening, understanding, and communicating with others. Types of difficulties listed include with speech sounds, receptive language, expressive language, pragmatic language, social communication and stammering, alongside less common difficulties. Some SLCN are short-term and can be addressed through effective early intervention. Others are more permanent and will remain with the person throughout their life. We will be outlining these needs throughout these videos. Communication chain. The processes involved in understanding and conveying a message between a listener and a speaker are complex and interlinked. Alkland's communication chain is a very simplified representation of what's involved, highlighting some of the key skills required to communicate verbally. Children with SLCN may have difficulty in understanding information conveyed through spoken language, have difficulty in communicating their needs, wants, thoughts, and ideas to other people, not understand the basic concepts of communication, and that they can impart information or impact on the behavior of others, find it hard to understand and or use words in context, use words incorrectly with inappropriate grammatical patterns, have a reduced vocabulary, find it hard to recall words and express ideas, have speech and language skills that are significantly behind their peers, and have poor or unintelligible speech. The development of language is a complex interplay of genetic inheritance and a language-rich environment. Speech, language, and communication are not skills that automatically develop for children. A child needs both a genetic inheritance and a language and interaction-rich environment. If there is a problem with either or both of these factors, then communication difficulties are likely to result. Some reasons for SLCN may include learning difficulties, neurological damage or problems during pregnancy or birth that may affect children's developing brains and contribute to their speech and language communication difficulties as part of a wider developmental delay. A recognized syndrome or disorder that causes communication difficulties. A hearing impairment. Emotional or behavioral difficulties. Autism, which can often include a language delay. Cleft lip and palate. Motor planning difficulties, for example dyspraxia, and specific difficulties in using oral muscles effectively, which may affect speech, for example a child with cerebral palsy. Socioeconomic factors. Economic and environmental deprivation, alongside other adverse childhood experiences, contribute significantly to the percentage of children and young people with SLCN. Some children and young people experience a lack of stimulation and support to provide the rich language experiences necessary to adequately develop their speech, language, and communication skills. Communication chain. The communication chain here shows how a pupil with poor language skills may present with less severe difficulties, but across a wide range of areas. SLCN is not always easy to see. Many children and young people who have behavioural difficulties have underlying SLCN. These needs often go unrecognised because behaviour can mask a child or young person's difficulties with communication. We often treat what we can see and do not consider or target the underlying cause. We will return to this topic later in this video. SLCN can be a hidden underlying need. Sometimes pupils who are placed on additional needs or monitoring lists or on the SEN register for other areas of need, often social and emotional mental health, SEMH, have SLCN which has not been detected. SLCN often presents similarly to specific learning difficulties, SPLD. Developmental language disorder, DLD. Developmental language disorder is a type of speech, language, and communication need that affects the way that children understand and use language. It is not usually diagnosed before the age of 5. The scale of SLCN. The first graphic shows 10% of children and young people have long-term needs. This is mostly made up of children with DLD. The remainder includes other conditions such as autism, and a very small percentage of children with severe and complex needs, which may require specialist education. Children who find communication difficult find life difficult. Language underlies everything we do. Language underlies much of what we do at school and in life, so it makes sense that children and young people with DLD are going to have difficulty with a great many things. If pupils have difficulties with any aspects of spoken language, you will notice the impact in their reading and written language as well. Some of these pupils will learn to decode so they can read aloud fluently, but this won't get them very far if they can't understand what they have read. Pupils with DLD are also likely to have difficulty learning new concepts and vocabulary, which then impacts their learning. They might struggle to understand your explanations and follow your instructions. In the playground, they might struggle with resolving conflicts and negotiating with peers. Even sports and games rely on language to explain the rules. A pupil with DLD may struggle with this as well. Compounding risk model. Oral language skills are fundamental for positive outcomes. The wider impact. Friendships, mental health, behaviour, employment prospects, academic attainment, reasoning, organisation, and social and emotional well-being. Links between exclusions, offending, and SLCN. Research shows that the most common reason for pupils being excluded from mainstream education is disruptive behaviour. Many young people who are excluded or at risk of exclusion have behavioural difficulties which co-occur with communication needs that are often unidentified and unsupported. Many young offenders have been suspended or excluded from their schools. A large number of these young offenders have communication difficulties, usually previously unidentified. There is a clear correlation between the groups of pupils who are disproportionately more likely to be excluded and the groups of children and young people who are more likely to have communication needs. These include disadvantaged children, children looked after, children and young people with a social worker and child, alongside pupils with SEND. Reflecting on behaviour and SLCN. Children and young people with SLCN may have a history of literacy difficulties, literacy floats on a sea of talk, not understanding instructions or language within lessons, difficulty learning and remembering vocabulary, difficulty asking for help, poor narrative skills, unable to explain what happened and why, being on time, and remembering to do tasks such as homework, leading to frustration, anxiety, social isolation and disengagement, and behaviours that challenge. Adults try to manage the behaviour. Why SLCN and SEMH are linked. Unless appropriately supported during the school years, pupils with SLCN are at high risk of developing mental health challenges as they get older. Research tells us that there are links between secure parental attachment and language development. Language is a vehicle for emotional literacy. This includes awareness of feelings, management of emotions, self-regulation, and understanding the feelings of others. Difficulties in expressing one's views and needs result in high levels of anxiety. And finding it hard to have conversations makes it difficult to negotiate with peers, resolve conflicts, and maintain friendships. Communicating awareness of SLCN with parents. It can be helpful for parents and carers to have some basic information that is specific to SLCN. This can happen through routine liaison with parents and could also feature on your school's website. This could include, for example, some basic information about SLCN that reflects both strengths and difficulties. A What's Typical Talk language development poster. Links to relevant websites. Providing advice and tips for parents. And information about upcoming parent training and workshops and events. This is the end of this video. Parts 2, 3 and 4 on this topic are now available to watch. You can view more videos on this channel in the About series.